Hi, thank you for taking a minute to learn about Connecting Cares. As everyone knows, the last few years have been really difficult. And in my practice, I have a lot of patients in education. And I've discovered that, for us in medicine, we've had a lot of work to do, but also a lot of recognition, a lot of support. And the educational community has actually had to retool their entire profession, oftentimes with very little support and very little recognition and a lot more pushback than we have experienced. So the other thing that occurs to me is that with the recovery from the pandemic, the educational community is really going to be the centerpiece of societal recovery for the next generations of adults. They know this, they know the work that lies ahead of them. We really are reliant on them for this next phase of recovery. And so the idea of Connecting Cares is simply to bring some recognition, support, and acknowledgement to the educational community and to help hopefully build some better bridges between medicine and education.
Every year, every 5 years, more things are added to educators' plates. Nothing typically is taking off. So there's constantly work to be done, work to learn, while always focusing on the student and trying to care for students. When it comes to social, emotional, and the needs of students and what we're seeing today, it's nice to be able to have a thought partner, someone else to bounce ideas off of, or at least have an agency show some interest in some of that work to be able to relieve some of the pressure that our teachers hold every single day, and the things that we see every day with our students, both inside and outside of school, and other things that impact our students.
Last couple of years in particular have felt really challenging in working with students, and it's primarily because they have had so many challenging mental and emotional needs in addition to learning in the classroom, and we've really felt that as teachers and needed to find ways to find that support. And having Chuckanut Health and Dr. Wu reach out and come to our school and talk with us felt really exciting because they acknowledged the challenge and showed appreciation for it, so that it really made, I think, us as teachers feel less isolated in working with students. And then also really gave this window of hope, I think, for seeing that there can be a partnership in the future or right now to support students, because I really don't think that we can adequately educate our students without having this combination of services of both medical and educational services.
For me personally, the experience of going to a school, bringing some gratitude, speaking with the teachers and staff was one of the most rewarding things I've done in the last year. And it gave me a boost that is still ongoing. I would invite you to be part of this. A lot of us are tired and burned out, and giving back in this way took so little of my time and energy, and just more came back to me than I put out. Let's just put it that way. So I invite you to join us. It will take a lot of us to get to reach the entire educational community, and I think you'd enjoy it. So I hope you join us.
The Chuckanut Health Foundation is working to build a community where every child gets a healthy start and every person receives the care they need throughout their lifetime. We are so proud to support this project because on so many levels it's putting care out into the world when we desperately need collective healing as a community. Thank you for considering being a part of it.